Okay, colleagues, let's make a start. Thank you for everyone who's been here on time, and I know that we'll have a few more joinees in the next few minutes. So welcome to this Nutrition for Growth accredited side event organised by UN Nutrition, the UN Development Programme and the World Health Organization, on building investment cases for nutrition interventions. My name is Nick Bannett-Valla, and I'm the head of the Secretariat of the United Nations Interagency Task Force on the Prevention and Control of Non-Communicable Diseases, a platform that was established in 2013 to support governments in their efforts to prevent and control NCDs, and the Secretariat is based in WHO Geneva. And I'm delighted to be your moderator for this session. Before we start, I'd just like to run over a couple of basic housekeeping issues. First of all, if you drop off and have trouble connecting, just close Zoom in at the application and start again. And if you have repeated difficulties, rest assured that actually this session is being recorded and so will be made available to everybody plus anyone else afterwards. You know that the webinar is going to last for 60 minutes, so that's quite a short period of time, and I'd encourage speakers to keep to time as much as they can. Please feel free, not just feel free, I encourage you, I urge you to communicate in the Q&A box. Only the panel members have access to speaking. The rest of us have to communicate through the chat box. And there's opportunities for questions and answers. One of the things I'm very aware of is there are often many experts in the audience who can add hugely to the dialogue. So please don't just add questions, but reply with comments and answers as well. Now, it's my pleasure to introduce Dr. Daoko Yamamoto, who's the UN Nutrition Chair and also the Assistant Director General of the Universal Health Coverage and Healthier Populations Division at WHO, who's going to formally open today's session. Naoko, the floor is yours.
Thank you, Nick. And distinguished speakers, ladies and gentlemen, and dear colleagues. As Chair of UN Nutrition, I'm delighted to speak to you as with one UN voice on nutrition. Building investment cases for the nutrition interventions is critical for NCD prevention and management, as well as achieving all the sustainable development goals. Investment in nutrition require a whole of society and a whole of government approach. They must include nutrition sensitive and nutrition-specific intervention to bring the strongest gain to society. Since the COVID-19 pandemic has exacerbated pressure on the aid for development, including domestic financing, we face the challenge of significant shortfalls in required financing for nutrition. So we need to invest in nutrition wisely, effectively, and sustainably for health and development for all people. Since 2016, UNDP, WHO, and the UN Interagency Task Force on NCDs have completed 27 investment cases for NCDs. Following these, 19 countries implemented 52 policy and legislative measures designed to reduce the burden of NCDs. Nutrition investment cases analyze the economic and the political economy of nutrition investment in countries. They help countries to advocate for investment, policy changes, and multi-sectoral responses. Today, we will hear from speakers about evidence to develop standalone nutrition investment cases. UNDP and WHO through UN Nutrition will collaborate with government to develop such cases that include WHO recommended cost-effective nutrition interventions. UN Nutrition knows that investing in nutrition also means ensuring that nutritious food are available and affordable for all. The Nutrition for Growth Summit is a huge opportunity to highlight how we can combine technical and financial resources to build nutrition investment cases as a tool to address malnutrition in all forms and leave no one behind. We support the call for more resources for nutrition and deliver more nutrition with the available resources. So I thank you and looking forward to hear from all country experiences and discuss with you. So thank you very much again joining this session. So over to you, Nick.
Thank you very much indeed for that, Chair. We now move on to the main body of the session. We're going to start off with a presentation around investment cases and the experience of investment cases in the area of non-communicable diseases from UNDP. And then this will be followed by a panel discussion with speakers from Thailand, Ethiopia, Uganda, and Fiji. So a great collection of panelists. And I'll introduce them as they go along. We'll then have some Q&As and try and field responses to issues that come up on the chat. And then we'll have the World Bank, the global financing facility based at the World Bank, drawing this together and leaving us with some food for thought at the end of this. So let's start off with Doug Webb. Welcome, Doug. You lead UNDP's Health and Financing team in New York. I think you've got a PowerPoint presentation that you're going to share with us.
Thanks, Nick. Hi, everybody. I understand the slides will be put up for me, if that's correct. Greetings from New York, everyone. My job is to quickly give a sketch of what the investment case essentially looks like in our experience working with WHO and the Task Force on NCDU Secretariat on these. And our belief is these are very, very useful tools. What are these cases? What in essence are they? Essentially, they're advocacy tools to provide evidence created in country. This is an important point. They're not created outside of the country, in country with governments to make better decisions about whole of government actions and really advocate for prioritized investments. We include political economy analysis, which we call the institutional context analysis, economic modeling, and targeted recommendations, which we have a series of stakeholder dialogues in, including media. The methods have been built up over a few years with economists. A number of countries we work with local economists in country. And we've started with the non-communicable disease, building on the best buys, working with on tobacco as a specific area with Tobacco Convention Secretariat, branched into mental health, and now looking at air pollution, alcohol, road safety, whole area of other areas. So the demand is huge, but the tools we use are very adaptable. Next, please. So the methods, I mean, this isn't very complicated, and it's for those of you familiar with what a case looks like in terms of generation of return on investment analyses. It's a four-step process of generating the cost burden. So what are your current costs from the diseases, in this case of malnutrition, if applied to malnutrition? What are your current losses on an annual basis? And you project those forward. What would be the costs of the interventions, and then the scaling up of those costs of interventions, again, targeted to specific groups and looking at inequities, specifically in that scaling up, and projecting those out over particular time periods. And we look at the political dimensions of that as well in terms of political cycles, 5 years, and then through the SDG cycle. The impact of those interventions, so what would be the benefits in terms of morbidity, mortality, and increases in productivity particularly. And then we look at the economic return, again, in the political cycle 5 year term. Next, please. So the history of this, don't be too bothered about all the different boxes, but essentially where we started was in the working with WHO and the Task Force Secretariat is in about 6 years ago now with the NCD, particularly the support with the Russian Federation. And as Anelka said, we've done a fair few now on the NCD specifically, but using the best buys. So having a benchmark of what a country should be achieving agreed mandate globally is a really useful starting. This is pretty essential, actually, when you've got a benchmark of targets or operational standards, which then can be applied in country. We looked at then the Framework Convention on Tobacco Control as another sort of agreed benchmark for operations. And then we're moving into other areas. Air pollution is another big area of expansion, road safety as well. But the neglected tropical diseases, so it is expanding exponentially, and it becomes a jigsaw puzzle. The ultimate, I think, extension of this is probably towards we would probably understand it as being universal health coverage. And then you can aggregate each of these components together. So for tobacco, over 24 cases, we look at a return of just over 100 for every dollar spent. 15 years in NCDs with a basic investment package of salt in this case. Example is 30 to 1, and each different component would have a different return. Some are having way more returns than others, but we've completed now, or near completion, around 95 of this. This has been a fairly intensive effort, but this has essentially been responding to demands. So there's very good reason that we can apply these to nutrition or various forms of malnutrition, or a composite of different types of malnutrition, depending on what is needed. Next, please. So we've done 64 countries have come to us, and as there is a sort of a minor bureaucratic procedure for doing this, we don't just sort of randomly wander around the world offering these out. There's a procedure of request through the WHO, through UNDP, through UNCT procedures, and there's a channel of authorization process which is agreed. We have guides and manuals, and we have a sort of procedure and a rigor of doing this, and the launch is with governments to sign off on the data. So some of the cases are at sign-off stage and can be there for some time, because there is very often pushback from some parts of government who don't like the figures. There's some pushback from industry who object to the case even being done in the first place, obviously. But this is very much demand driven. Demand is growing all the time. Next. We're very conscious of making these things look very beautiful. There's some examples of these, but there's a suite of products, and what is most useful probably is simply the slide deck that comes out of this, which is then distributed and used, and it's used for the launch events. We go into Parliament, we work with the standing committees, we use them for media, and we find that getting out through various channels, working through civil society as well, and the more noise you can make around the simple questions, are you prepared to keep tolerating these losses we calculated when there are cost-effective you could deploy for these calculated benefits? Those kinds of questions that you with stakeholders are very handy questions. So we're conscious of the presentation of this information with government. So these aren't UN coming in and wagging a finger process, co-created, co-presented pieces of action. Next. The impacts, tracking these impacts itself is quite an exercise, because sometimes the impacts are immediate, sometimes they are a week later, sometimes they can be years later. We've categorized the impacts. We've counted at this stage about 56 across 30 countries. Most of them are fiscal in terms of taxation, particularly, or pricing. So we find taxation changes or pricing, particularly, but usually it's taxation. Sometimes we find that the government will rearrange itself like a plan or mechanism for coordination across sectors, the whole of government actions, restrictions on advertising, so on. Salt, we find there was a case, Rano may be able to talk to this later, that Thailand last week, NCD case was launched and the salt tax is being discussed. We found salt Philippines as well. So when you have a very high return on investment presented, which we find salt very often is one of the highest return, and in a very short period of time as well, you find galvanization of quick wins. And very often, if you have a high return on investment presented in a short period of time, politically that is very attractive. So you find that if you can present your returns on an investment in a way that you can find political capital somewhere in those returns, you often find you can move your picture forward, and you can Trojan horse some of the other things which are less politically attractive in with them as part of a package, recognizing that industry in various forms is watching, counter narratives are coming in. And sugar sweetened beverages, we've had success in the Caribbean and Gulf states, where we find taxation regimes are quite quickly moving. Saudi Arabia comes to mind immediately, where you present the data and it is an immediate change in dialogue and emphasis around taxation. So we're very encouraged, and sometimes it's an immediate change, sometimes it can happen through the legislative process years down the line. Few specific to nutrition, I think this is the last slide. So just to make the point that, again, it's political capital very often determines something, not so much the economics of. Chris Tufton, Jamaica, used the investment case, which we did in 2018, and just a few weeks ago launched the front of package label campaign, which obviously is a nutrition policy change, but used the 2018 findings. So even if the return on investment wasn't very big in the pantheon of ROIs that we generate, but he used it for political purposes, or the very fact that we went in and generated this data with the industry. So very often we're surprised by what is used. It isn't always obvious. Bahrain, there was some movement around trans fats elimination, and Ethiopia, hopefully Dr. Zelalem will be able to talk to this specifically, but again around salt. So each country, very often you go in, you present a range of options, and the government will find a way of very often using what you don't expect in terms of policy change, depending on the political circumstances, and weaving your way, working with parliaments and the legislative space is very often the most critical avenue found, and the media being a partner is essential, and so on civil society. Next, I think that might be it. Yeah, so we could talk all day about the impacts and the experiences, but that's a very quick sketch of our experiences. We've written a lot of this up, we'll certainly provide more information as needed. Thank you.
Great, thanks very much, Doug, for describing the methods and the scope of these investment cases, also highlighting the demand, the adaptability of the methodology for the right context. I like your analogy with the jigsaw puzzle, that this is about bringing things together rather than siloing things, outlining how countries are using them to engage on policy dialogue, the importance of not just the economic, but the institutional context analysis to know where those opening and entry points are. And you highlighted the importance of industry and managing those conflicts and differences of interest as well. Now let's get some more granularity from some of the countries. And as you just highlighted, Thailand's been a recent recipient of an NCD case. And it's great that we've got Reno Meyer here, who's the UNDP resident representative, to talk to us, and no doubt will be talking to us not only about the investment case for NCD, but also the opportunities for one that's specific for nutrition. So Reno, welcome to you. The floor is yours.
Thanks very much, Nick, and very good evening or very good day to everyone. A pleasure, and thanks very much to the whole UN Nutrition team to inviting me to join you on this webinar. I mean, Doug has led the stage very nicely for me. Indeed, as you've mentioned, Nick, and Doug alluded to it also, we just launched the NCDU investment case last week, and it came as the result of a thought process that will speak to the impact of what we're trying to get at. I'll start going backwards a little bit to 2018, when a mission from the UN NCD working group out of Geneva came to Thailand and visited the country, looking at the issue and raising, the problematic behind the NCDs. And it was received by the Prime Minister himself, and who showed a lot of political commitment and leadership to address NCDs and really link NCDs to numbers and how it was impacting society. It led to the creation of a UN working group on NCDs with a lot of government interest in it. But there was always this feeling that we were struggling to get the issue on the headlines, struggling to get it out of a type of a usual suspect type of approach, where all the health practitioners were convinced of the problem, but they really were struggling to put this on the agenda of other colleagues in government and decision makers. So about a year ago, we brought up this methodology, the investment case, and I think it really demonstrated the impact that and the shift that it can operate at country level. The investment case, as Doug mentioned, brings a whole methodology, but also some space for flexibility. And when you design the terms of reference of the exercise, you can really put in, what really matters in a given country. And here in Thailand, in addition to the traditional NCDs, the question of air pollution, for example, is very, very critical. So we were able to insert this in and come up. So what it allows us to do is to come up with to go beyond the political commitment, even of a prime minister and a head of state. It's really to come up with numbers that are going to be used with the support of the media, with the support of civil society, to trigger a reaction in the general public. So when we come up with headlines that says that the 4 main NCDs are responsible for 74% of all deaths in Thailand, when we are able to put numbers that say that 1,000 people die every day because of the NCDs, right? And then we start unpacking this, and we come up to very specific and less already health exclusive references, because you can link it to other issues. For example, one striking finding of the investment case of Thailand that we just launched last week was that the progression of obesity among students between the ages of 13 and 15 years old went from 5% in 2008 to 23.5% in 2021. Right, so such an alarming figure would have gone most likely unnoticed by the general public if we had not undertaken this investment case. And then you conclude this by putting financial numbers, and then you talk about return of investments. But the headline here is really that basically the economic burden of NCDs on a country like Thailand equates to 10% of its GDP. Right, so when you come up with those numbers, that allows you to take the issue out of a purely health sector specific environment, and you go to the Ministry of Finance and you whistle down the corridor and you go out and say, that 10% of your GDP is lost because of NCDs. It suddenly becomes more than a health issue. It suddenly finally gets the attention of decision makers that realize that unless there are changes, fundamental changes in the various root causes that lead to the NCD situation, the country is definitely missing on a lot. And that was the whole objective of this investment case. And the launch last week is triggering a lot of reaction among the general public. We're getting a lot of media attention, and now we're unfolding the whole gamut of tools that we use across the various agencies of the UN system to get the attention. So Doug made a very important point that we see very true here in the context of Thailand, the importance of bringing this to Parliament. Parliament with its function on legislation, but also its functions on budget allocation. And when you compare, the price, the cost, the burden of the NCDs to the financial gaps on the achievement of the SDGs, for example, and you start making comparison, you really get the attention of the financiers, and not only of the public financiers, but also of the private financiers. You can link it to the whole discussions around insurance, right? So we're bringing it, and as UNDP, we're now linking the findings of the NCD and the different messages that underpin the report to some of the interventions that we have as part of the country program of UNDP. So the work that we're doing with the Ministry of Finance on the integrated national financing framework, the whole SDG financing portfolio, it offers a lot of interesting insights on how we bring the whole issue of fighting non-communicable diseases and convincing the interest of financing their prevention as part of the overall budget documentation. We're basically widening the audience, to the issue, which is exactly what we need to do. Another area of linkages that we're pushing is the work that we do on food systems, and in the context of the Food Systems Summit that just took place in September with our FAO colleague, and looking at how linking this time to nutrition, we can really improve the whole supply chain. We can link the dietary consumptions and habits that the NCD investment case is highlighting to bringing it literally to the table of the Thai households, and linking what they put in their plates or not put in their plates. And here we also have very interesting figures on food habits in terms of vegetables and fruit, for example, and that are mind-boggling in a country that is well known for the quality of its tropical fruit. It's less than a third of its youth that actually regularly eat fruit. Right? So you have a really golden mine of data and evidence that you can use in very different settings with different target audiences to bring attention to the whole issue. We're also linking, and this is very important in the context of China, a country which is extremely centralized in the state system. We're trying to also, in addition to a top-down approach of bringing the message of the NCDs to the local communities, we also want to bring a more bottom-up approach. And there, the whole work that we're doing with local communities, using the SDGs as an entry point for decentralization, including fiscal decentralization. We've discovered that on, for example, fighting tobacco, there is in the law a provision for a provincial anti-tobacco committee to be formed, which remains very much a theory and a provision of the law. Very few governors have actually implemented this, and if we are now have the material, the data, and the evidence to link some of those to the reality on the ground, and it's going to be much easier to convince governors of the importance of addressing not only tobacco, but all the NCDs through the findings of the investment case to this bottom-up approach that will complement very nicely the work that we're doing. So we're seeing really how much we can leverage an investment case, smartly using from a communication perspective the key messages and the numbers, the evidence that this provides to our advocacy work in the broader framework of the achievement of the SDGs, like the chair of the UN Nutrition group indicated in her opening remarks, how this is a very important, I would say almost a precondition to the achievement of many of the SDGs when we really draw attention to the reality and put numbers against political commitments of fighting the NCDs. So here in Thailand, a very interesting experience that will give us leverage for a number of months to come, and that we want to also use as a springboard to then unpack, a certain number of more, I would say, detailed sectors that are also a combination of not only health-related matters, the impact of the poor air quality on health, but also on the broader economic front, the link to climate change, the link to biodiversity conservation, the link to the ways that different social groups interact in society towards social cohesion between indigenous groups in the mountains that are always finger pointed for their burning practices. So I mean, you could go on and unpack all those matters, in many different ways. So the key message that I really wanted to convey based on our experience is really how an investment case allows you to broaden your audience in terms of the key messages, and how by linking them to existing tools that you have of programmatic interventions as part of a UNDP agency, but I'm sure other UN agencies representative could say the same thing about their own portfolio, how you can use the content of an investment case in continuing in a win-win relationship the work that you do both at advocacy and programmatic intervention in terms of the achievement of the SDGs. Nick, I'll stop there, and I'll be more than happy to take a few questions when they come up. Thanks so much.
Well, thank you very much indeed, Rainier, and sharing your experience from Thailand. The importance of bringing our agenda to those beyond health is well taken. Widening the audience, as you say. You brought up the issue of engaging at the head of state level. You talked about finance. You talked about the importance of the media. You also reminded us to think about broader issues which we don't always think about, like air pollution. So that's really helpful. I'd really encourage people to be continuing their discussions on the chat. There are some points that are going backwards and forwards. It's great that people have introduced themselves from Pakistan and from Vietnam and Sudan, South Sudan, Kenya, Somalia, Thailand as examples. So please, let's have these questions and these comments coming in. Let's make it as interactive as possible. Now, our next speaker was due to be from Ethiopia, but I understand that last minute has an alternative engagement and so isn't able to be with us. So that means we are not going to hear from Dr. Zilalem, but instead we are going to move straight on to Charles Asimwe, who is the Senior Nutritional Advisor in the Uganda Nutrition Action Plan Secretariat, which is in the office of the Prime Minister in Uganda. So Charles, welcome, and over to you, please.
Thank you, colleagues. Can you hear me?
Loud and clear.
Yes. I'm Charles Asimwe, also of the Prime Minister for the Republic of Uganda, in the Director of Strategic Coordination and Implementation, which coordinates the implementation of the Uganda Nutrition Action Plan. And my communication, I already alluded to it, that we are going to present a few slides on our investment case for Uganda and the lessons learned. And I will briefly mention that Uganda joined the SUN movement in 2011. And since then, Uganda has been implementing multi-sector nutrition interventions through the Uganda Nutrition Action Plan. We had the first one of 2011 up to 2020, and we have now recently approved the second one, which is running from 2020 to 2025. The key challenge over there, in terms of the subject of today, over the last 10 years, we have been having a challenge of understanding the financial gap on our budget and of budget support to the scaling up nutrition. But in 2019, we conducted an expenditure review where we completed it in 2020, and the key findings are listed as follows. In 2017-18, the expenditure review informed us that the percentage expenditure on nutrition is 0.05% of the national budget. Our national budget is $12.6 billion US, and we found out that the expenditure is broken down into specific, sensitive, and governance. It is close to 0.05%. Then we saw that in 2018-19 it was 0.07%. Then in 2019-2020 it was still 0.06. But when you go into the actual figures, we find these figures are actually aggregated and somehow not explained well. But the current expenditure review we are going to conduct is we are going to be focusing on the breakdown of actions which are within the UNAP. You need to note that in the development of the UNAP 2, we have a UNAP 2 which is costing which is going to cost us a total of around $1 billion for over the 5 years. And we have committed that in the next 5 years, at least 10% of the total budget of the country should be allocated to the implementation of the UNAP 2. And this one is committed on the fact that the intervention that we have proposed during the next 5 years are linked within the national budget. For the first time, the national budget has a lot of figures committed for investments in nutrition specific, sensitive, and governance. And we hope in the next 5 years, we shall have got good progress on financing for nutrition. I can quickly mention to you that the total, the areas of expenditure for nutrition in Uganda, as I mentioned, over the next 5 years will be $1 billion US. And after doing the investment case, which we have conducted recently, we have modeled 15 interventions and noted that when those 15 interventions are modeled, they contribute a cost of $0.2 billion US Uganda shillings. So US dollars Uganda shillings. And this would actually be a third of the total budget for the UNAP2. And if we scaled up those interventions across, a lot of lives are saved. We have a summary. I will present the summary later of those figures in the document I will send out to later. But we have also noted that if we invested in every dollar of investment we make in those 15 interventions out of the 102 in the UNAP2, we get worth $7 US of return. Colleagues, this will mean that even after implementing the 15 interventions, which are modeled, and then we add the balance of all interventions we have not modeled, it can even make us close to the figure which has always been mentioned, that when you invest $1 US of nutrition, you end up getting $16 US of return. At this point, I would want to stop there briefly, and maybe what I could mention also is that we have invested in multi-sector programming as a country, and the value added by OPM is that the Office of the Prime Minister's strategic position for coordination of government business, and it uses the Article 101 of the Constitution of the Republic of Uganda, which gives the government through OPM, the Office of the Prime Minister, as the leader of government business and coordinator of all my sector programs. And as we speak now, around 17 ministries, departments, and agencies are always together in the house to discuss nutrition issues. As I speak now, I'm in a meeting where I'm handling the advocacy and communication strategy for Uganda. We have actors from the civil society, we have private sector, the academia, and all local governments in particular. So the availability of the coordinator being Office of the Prime Minister has provided both policy and legal framework environment that can make us move together. Quickly, briefly, that's what I can mention, and I will be available for any comments on our quick over the presentation. Over.
Great, thanks very much indeed, Charles. I'm not sure whether or not we can see you, whether or not you can put your camera on. It would be lovely to see you and to wave to you, but maybe your camera isn't functioning.
I am there. I think you can see me.
Brilliant. Okay, that's fantastic. Thanks very much. There you are. Excellent. Well, thanks very much indeed for that. And what's been really valuable about your intervention is that you've been able to really now dig deep into some of the budgetary issues. And it's kind of like where the rubber hits the road and starting to use some of the thinking to actually determine how you influence the different budgetary determinants for moving forward on this. And we've seen some really good comments that are coming in at the moment here, and I'm looking at some at the moment. We've had a comment from Joseph Tinawo about how important this is for Zimbabwe, that only 2% of the entire population is affording healthy diet, and the importance of identifying the economic impact and costs of NCDs as being really critical. So thanks for that. Thanks, Dudley, for putting the link up for the Thailand investment case and talking about the recent plan to issue the tax on high sodium food. So we'll continue to monitor those. And we've got somebody asking some more information about Ethiopia. So please feed into those as we go. Now, after Charles, we've now got a video recording from our Fiji representative, Jonathan Vetch from UNICEF, who's the UNICEF Pacific representative based in Suva, overseeing UNICEF's programs and operations in 14 Pacific island states. So have we got the video available?
Dr. Naoko, Chair of UN Nutrition, senior government officials, UN colleagues and partners, ladies and gentlemen, Ulabenaka. A very good morning to you all from Fiji. On behalf of the Pacific UN agencies leading our collective response to malnutrition, including FAO, IFAD, UNICEF, WHO, and WFP, I would like to thank the UN Nutrition Coordination Unit for providing the Pacific with this important opportunity to present at this event today. In the Pacific Islands, the overwhelming success in developing the national food system pathways is exciting, and we have renewed hope that the Pacific will achieve the SDGs once these pathways are implemented. In recent years, we have successfully mainstreamed prevention of stunting within policies and developed and implemented high-impact nutrition interventions. We were able to reposition healthy and nutritious local food and diets among women, children, and adolescents, while more tailored investments have increased in nutrition-sensitive agriculture and value chains, and helped in building resilient agriculture, fisheries, and forestry production systems. There has also been progress in preventing and managing NCDs, and a new mobile vulnerability analysis and mapping (MVAM) system was successfully launched in Fiji, Samoa, Tonga, Vanuatu, and Kiribati. Despite these successes, there still remains an urgent need to invest further in nutrition in the Pacific Islands. A majority of young children in the region do not have access to a diverse diet due to a shifting of diets away from locally grown foods to highly processed and imported foods, contributing to a triple burden of malnutrition in the Pacific. This triple burden of malnutrition includes a high prevalence of stunting among children under 5, high rates of micronutrient deficiencies such as anemia, and increasing overweight and obesity rates among young children, adolescents, as well as women. Food systems in the Pacific are particularly fragile due to the country's geographical remoteness, increasing climate shocks, and logistical challenges. COVID-19 has further exacerbated these challenges with reduced incomes and less social sector financing for nutrition. This is likely to be the case for several years, given the current debt burden of the SIDS. Pacific Island countries are among the most at-risk countries in the world for climate change impacts, which have significant consequences for food security and nutrition. Food stability and affordability is threatened by water and soil salinity, higher frequency and severity of extreme events, and the subsequent impact on crops, agriculture, and fisheries. Through the current UN Pacific strategy, outcomes 3 and 4 are focused on improving nutrition and food security, agriculture, and basic services, with significant expenditure in the 14 Pacific countries. However, it is not nearly enough, and in the new UN strategy for the Pacific being developed now, we need to go much further in such policy areas of labeling, marketing, and taxation, and the school environment. We need a real Pacific food revolution. There is also a significant funding gap to address the high rates of the triple burden in the Pacific. Increased investments will be required to meet the World Health Assembly nutrition targets. As you know, nutrition interventions are among the most cost-effective in the long term, with every dollar investment delivering a $17 return. It's critical to increase investments for nutrition in the Pacific, where more than half of the total deaths are linked to NCDs and have a huge burden on national health and economic systems. In addition, there's an urgent need to develop a nutrition investment case beyond salt reduction to include more nutrition targets representing the triple burden of malnutrition, particularly high BMI among women and children, breastfeeding strategies, marketing restrictions, food environment, fiscal policies, packaging, and labeling requirements. A strong nutrition investment case will aim to explain the health and economic burden related to the triple burden, the cost, returns on investment, supported by tailored advocacy products and an engagement strategy with key sectors. This could be piloted in countries like Fiji, Kiribati, and Tonga due to their strong multi-sectoral stakeholder engagement in food systems dialogues and leadership in food fiscal policy, which would benefit all the Pacific Island countries. Disaggregated data and regular monitoring, including through MVAM, remains critical for evidence-based resource allocation and to ensure no one is left behind. A public sector expenditure tracking for nutrition has been initiated in the Pacific and is recommended to be expanded and continued to track progress on investment in nutrition. This is what is required in order to address the significant funding gap to deal with stunting in a few countries, as well as anemia, overweight, obesity, and other diet-related NCDs in all the Pacific countries. International nutrition financing needs to be further increased for the Pacific countries to address existing nutrition inequalities, fragility, and disaster risks, and must be tailored to the Pacific context in order to sustainably achieve the SDG nutrition targets. In a context where for many, the climate crisis is existential, this is more urgent than ever. Thank you for listening, and I wish you all very fruitful deliberations.
Great. Well, thanks very much for that. That was a presentation that was both broad and deep. We got the SIDS perspective. We got discussions on COVID-19 and the impact of the pandemic. We heard about climate change and food security. So that was good. We heard about the broader issues around the Sustainable Development Goals and heard about leaving no one behind. And then we heard the value of the investment case, which I thought linked in very nicely to Doug's presentation right at the beginning. So it brings us full circle. And it also then brings us on to our next speaker when we were talking about financing and increasing international financing for nutrition, which allows me now to introduce us to our final speaker, who is Leslie Elder, who is the Senior Nutrition Specialist in the Global Financing Facility housed in the World Bank. And Leslie, you're going to try and draw this together, bring together the discussions and leave us with some sort of important take-home messages on how we coordinate and build up our collective action in this field. So welcome and over to you, Leslie.
Thank you so much, Nick. It's great to be here with all of you, and thank you for allowing me to be part of this event. We have heard from the panelists, it's been a great discussion so far about their experiences in developing investment cases for nutrition and their critically important role in advocating for the investment in policies and programs that will address all forms of malnutrition. I wanted to just situate my own agency in this context, in this conversation, very briefly. I work for the Global Financing Facility, which is a multi-donor trust fund housed at the World Bank. We work in 36 countries, and our aim is to get to 50 countries. We are a country-led partnership model for global health and nutrition linked to sustainable financing and to results. And we're focused on ending preventable mortality among women, children, and adolescents, as well as improving health, nutrition, and well-being. We support nutrition alongside health systems strengthening in order to have nutrition actions that are integrated into stronger health systems and allow you're better able to deliver quality nutrition services at critical points along the life cycle. As with all of the speakers so far, at the core of the GFF model is a national investment case, and we work with countries to develop a prioritized costed plan, an investment case that lays out the pathway to scaling up universal access to a basic package of reproductive, maternal, newborn, child, and adolescent health and nutrition services, along with critical health financing and system reforms to accelerate progress towards universal health coverage. And I would note that the bulk of our grant resources co-finance World Bank projects, which means that some of the comments you heard earlier about bringing this to the attention of ministries of finance is part of our model. And I wanted to specifically talk about the way we tackle some of these double burden of malnutrition issues. Our countries, the 36 countries in which we are now, tend to be at the lowest, at the bottom of the Human Capital Index, for example, where we see this dual burden of malnutrition, where issues of undernutrition, wasting child, and stunting are coexisting with an ever-burgeoning problem of overweight and obesity. So as we tackle, for example, infant and young child feeding in the first 1,000 days, we are well aware that exclusive breastfeeding and continued breastfeeding, as one example, is an intervention that has ramifications both for correcting child undernutrition, but also laying the foundation for healthier diet and the prevention of overweight and obesity later in life. So in collaboration with partners such as WHO, the International Food Policy Research Institute, and others, we are working to contribute to the body of operational evidence and knowledge about how we can better employ tools such as exclusive breastfeeding and platforms such as school health and nutrition to better address, again, all forms of malnutrition. I would say that we are only at the beginning of this journey, and I think that is one thing that we need to acknowledge as a collaborative group of nutrition people here today. We have a lot of work to do on understanding how we frame the issue of all forms of malnutrition, how we take issues such as exclusive breastfeeding and message around the ways that we can better implement those interventions, those tools, to then address later in life other forms of malnutrition. We need to break down the silos. I think it's very clear to all of us working both globally and at country level that we have siloed approaches to undernutrition and overweight, obesity, and diet-related non-communicable diseases. And we need to do better at talking together and thinking how we can apply a lens that addresses all forms simultaneously. We have heard from all the speakers today about the fundamental role that malnutrition plays in the human capital development agenda for their countries. And we also heard from Dr. Yamamoto about the threats to nutrition financing triggered by the pandemic. And just recently, the Global Nutrition Report 2021 highlighted the fact that we have an increased nutrition financing gap. Previously, it was estimated that $7 billion a year was needed to address nutrition-specific issues. We know now that it's now at least $10.8 billion a year. And when we consider all aspects, nutrition-specific, nutrition-sensitive interventions that are required, the financing gap is $39 to $50 billion a year. However, as the Global Nutrition Report also reminds us, while these costs seem high, and we heard this today, the costs of not intervening are even higher. And just to note, yesterday here in Washington, DC, and in the main newspaper in the capital, the Washington Post, the headline of an op-ed piece on the human and economic costs of diet-related non-communicable diseases read, "What will make us pay attention to nutrition?" I think that's a rallying cry for all of us. It's imperative that the traditional sources of nutrition financing continue. And we know that the Nutrition for Growth Summit is demonstrating the interest and momentum for governments and donors alike. But we also know that we need to look to innovative financing mechanisms to help fill the resource gap for nutrition. And that's going to include non-traditional sources of financing and definitely engaging with the private sector. So I just wanted to end with saying that we know we must work together across all sectors in both public and private spheres to address the financing gap if we want to achieve the Sustainable Development Goals in their entirety. So I look forward to hearing Nick with the closing remarks, and just to say that we do need to come together to make this undeniable case through investment cases for addressing all forms of malnutrition. Thanks. Over to you, Nick.
Thanks very much indeed, Leslie, for those compelling messages and that very clear summary. And I'm not going to try and summarize what you summarized, because I think you did it excellently. And I think the speakers should just be left with your words ringing in their ears. The only thing I will just remind us is that you did talk about the media, and just reminds us yet again about the power and importance of getting our messages out through the media. So, we're 1 minute before the end of this 1 hour session. I'd like to thank everybody who's participated, specifically those people who've participated in the chat, but also Nalco, for you as the chair of this session, for the panelists, for their compelling arguments. The recording, as I said at the beginning, will be made available on the UN Nutrition landing page, so please do view it again and share it with others. So thank you very much indeed to the UN Nutrition Secretariat, who have brought this really productive, effective and stimulating discussion together. Have a good rest of morning or afternoon or evening, wherever you are. Thank you very much indeed. Bye-bye.